Hello, my name is Elvis Torres and I'm the director of the Ageless Center. I went to University of Miami undergraduate and I attended the Southeastern College of Osteopathic Medicine down in North Miami Beach, Florida, where I did my medical school, and I did a one-year rotating internship at the Universal Medical Center in Florida, followed by a 4-year residency in the University of Alabama in Mobile, Alabama. From there I came to Houston, Texas, and I've been practicing here for the past 11 years. I think the important thing to keep in mind is that we all get so caught up in everyday events, and as far as running a rat's race, we forget to just stop really and appreciate every moment. I try and teach my patients not only as far as their personal health needs, but also too to just, again, enjoy their life, be happy. It helps reduce your stress, it helps you really be happy, and happiness is one of the best things we can do for our health to begin with. When we're in the office, we make sure that each patient is taken one at a time. We tell our patients sometimes the visits may be a little bit longer, sometimes a little bit shorter. It always just depends on what the needs of that patient are for that day. Originally, when I was in training, I thought about being a plastic surgeon. And what happened then was I did my rotation and delivered my first baby. And there I was hooked. Once I saw that baby in my arms, and I was the first one to touch that baby, I thought, this is the coolest thing I've ever seen in my life. This is what I want to do for the rest of my life. And that's how I got involved in obstetrics and gynecology. Still to this day, still get a kick out of every baby I deliver. It's just, there's no comparable feeling to that at all.
He takes an extra concern about the patient, follow up and so forth. And you feel comfortable about coming to him. It always bothered me. I didn't think there was anything you could do for that.
Yeah. The biggest factor I hear all the time from my patients is I listen. I hear that over and over and over again, and I really feel proud about that because, again, I take my time with each patient. And so sometimes that means that your office visit may be a little bit longer than you expected, but I'm proud to say that, again, the comment we hear over and over again is you're the first doctor that's listened to me.
He's compassionate, and that's his strength. Compassionate with good side manner.
Okay. You want to see us taken care of?
He never seems to be in a hurry, and I know that he's got a lot of other patients to see. Takes the time. He cares a lot.
Well, I tell my patients all the time, no one needs Botox. Botox is something that you get because you want to try and reduce your chances of having fine lines, wrinkles later on in life. But who needs Botox? No one. We try and offer that service to our patients because a lot of patients are concerned as far as some of the lines that are developing from either driving out in the sun and they get the crow's feet along the eyes, they get the frown lines from kids, and so it's something we offer as a service to our patients because a lot of patients want it. I think the reason the patients should get the Botox here is because, again, they know who I am, they trust me, they know my technique, they've seen my skills in other areas of their healthcare, and so they know what they're getting. Your left eye is not as prominent as your right eye in the lines underneath. See that?
Oh yeah.
But I see a lot of patients asking for when they're getting Botox, they want their self-esteem back. They feel they're getting older, they just can't keep up with the younger crowd. Sometimes we'll actually have businessmen that will come in and feel they're losing their competitive edge. And so again, that's why I'll tell our patients when they come in for things like that, that it's as important to keep the inside, okay, as rejuvenated as possible, as well as the outside. The thing with Botox is it really helps you put your best face forward. A lot of times in society, you only get one chance to make a first impression. And Botox and some of the other procedures we offer here in the office will help you put that best face forward.
Tickles!
It tickles? Okay, that's what I wanted to hear. Botox is said to be king in most medical spas, but around here, laser hair removal is king. We have more patients that come in for laser hair removal than we do for Botox. Can I not your face a second? Funny thing about laser hair removal is it's addicting. Once you see how well it works, you want another area and another area. And especially being out in the South where we have sunshine, we have beaches, people wearing shorts, you know, people are really excited about being able to not have to worry about shaving, they're getting the hair, ingrown hairs, infections, or always having that clean look. We'll have women that'll come in and they're talking on the cell phone while the procedure's being done. Other people just go to sleep. Some women will come in and bring a friend with them, and they're talking the whole time with their friend while the procedure is being done. And it's relatively painless. The procedure we use, the machine we use, is called a gentle laser. And the gentle laser, what's nice about it is it's designed to be significantly less painful than other lasers out there. And it's one of the best machines for laser hair removal available. And you can cover an area as the size of a face in approximately 15-20 minutes and be done. This could be a procedure you have over lunch. And by the time you go back to work, no one will know you had anything done. over the course of several different treatments, you can eliminate up to 90-95% of the hair. In our office, we don't charge the same price each treatment. Because of the fact you need more than one treatment, we make it a point to lower the price after the treatment, so that way it's more affordable to the patient. Many places will make you buy a package. Therefore, you have to prepay all the treatments ahead of time, whether you need one or whether you need 8. Most of the people that come in looking for fillers are looking to just kind of reshape their face again as far as the way it looks. For example, somebody has circles under their eyes that are due to loss of fat in that area. What the filler is going to do is going to go ahead and fill in that area, add some volume to it, plump it up, so that you see less wrinkling, adds more volume, and redefines the shape of the area you're treating. Different kinds of fillers. There are some that are permanent, there are some that are temporary. We'll see sometimes people come in with frown lines, either down in this area here, they'll have little defects here, and it almost looks like they're sad. And so there we use a combination of treatments. We'll come in with some Botox to paralyze the muscle, and then afterwards we'll go ahead and then fill in whatever defect has already been formed there to add a little bit more youthfulness to the face. Urinary incontinence is something that affects many women and many men as well too. But in our office we deal with incontinence for women. Usually what we see are patients that come in for an annual exam, no issue specifically with incontinence, but they'll come in and during the questioning we find out that they've been having leaking of urine for many years. Sometimes it's gotten to a point where they've reduced activities or eliminated certain activities that they used to enjoy just because of fear of leaking. Now with some of the newer methods, especially the one we use, it's an outpatient procedure. You go into the hospital and you go home the same day, no catheter, no leg bags, and it requires simply about a 2-day recovery period and you're back to work. But it's a very common problem. I'd say in our practice, of the women we ask on a regular annual exam, probably at least 1 out of 3 are suffering from incontinence. Sometimes it's minor, in which case we offer some behavioral modifications, some treatments they can do at home to avoid surgery and fix the problem. In other cases, it's severe to the point where they have to wear a diaper already because they can't control it. And in those cases, then surgery is usually the best option.
He made me feel secure, that everything was going to be okay. And not only him, his nurse Martha, you know, private cell numbers, nobody does that. My daughter's comment to me was, "Mom, they're so nice. I feel like I've known them a long time."
The way we offer body sculpting, I think, is very important to be differentiated from traditional liposuction. We offer tumescent liposuction, which is an advance over traditional liposuction in the sense that you don't use general anesthesia. You use local anesthesia. By doing so, you eliminate one of the biggest risks of any surgery, which is the general anesthesia. And there are risks associated with general anesthesia that in this tumescent technique are gone. And one of the other benefits to using tumescent technique is that if you were to try and go too deep with the probe, your body will let me know before I perforate the abdomen, therefore reducing the risk of injury to the bowels, which again is another one of the biggest risks associated with traditional liposuction. Almost all our patients have gone back to work in 3 days. They'll have the procedure done usually on a Friday, and by Monday they're back at work. We have one of our patients who went dancing the night after we liposuctioned her thighs. Another one drove to Mexico the day after we had done her abdomen. And we actually have one patient just recently who the night we did her liposuction, that same night she went out to dinner with her husband. And I thought, well, make sure you eat a low-fat meal. Don't put it back in. That's a big source of referral for us, is when patients show off our work afterwards and their friends see what a difference they look like. I think what sets me apart for the liposuction is that, again, I've gotten the training. I've taken the time and the effort to take the training, not just once, but went back and took an advanced course and a repeat course to make sure that I had the technique down before I ever offered it to my patients. And I want to make sure that when I'm doing it, I do the best I can. There are many other procedures out there that my patients have asked me if I want to be doing those, and I tell them no. I want to master each procedure one at a time before I think about introducing another procedure. One of the other benefits to doing liposuction and tumescent technique is that since it is done under local anesthesia and not general, we can do it in the office, saving the patient thousands of dollars in cost as far as hospitalization and anesthesia bills. One of the things we'll tell our patients a lot of times too is we'll have patients coming in asking for tummy tucks. And most of the patients who come in asking for tummy tucks really don't need a tummy tuck or an abdominoplasty. What they need is just a liposuction. And we've had patients where I've told them, do the liposuction. And if it does not get improved like I think it will, like I'm promising you it will, you don't pay for it. And I've shown them how they got the results they wanted without the abdominoplasty, without the tummy tuck, with a recovery time significantly faster, a cost much cheaper, and the appearance they wanted, and without the scar of an abdominoplasty. And there are those cases where they do need abdominoplasty, and I'll tell them, you don't need liposuction, you need an abdominoplasty. And so again, I want to be honest with the patients, and I want to make sure that every patient I do comes out so good that I can show them off.
I'm a nurse myself, so I searched around for who not only that I would trust, but who has a good reputation and who has excellent outcomes. And with him, we have always felt through my investigations that he did have the best outcomes and the best bedside manner, and just makes you feel comfortable and at ease during the procedure.
He brings his family environment right to work.